Okay, so we're going to be doing an insulin infusion. So first I'm going to be reviewing the physician's order against the NURS. So we have Scotland, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 24 years old, 24 years old. So we have an order for insulin Humulin R, continuous IV, to be run at 2 units per hour, 2 units per hour. It's been ordered for today and now, and it's been signed here. So now that they match, and we also have our goal blood glucose of 6 to 10 on our order here, so we'll be monitoring for that. I'm going to go over the PDM. So for insulin Humulin R, it's a high alert medication. It's an anti-diabetic. Since it's a high alert medication, it needs to be independently double checked by another nurse. It can be given IV continuous by nurse or student nurse. We've gone over the physician's order and specified so our rate of infusion, frequency of blood glucose monitoring, and yeah, we know that we have, we're good. So for our dosage, for IV continuous, normally it is 1 to 10 units per hour. We're within that with 2 units per hour. Our IV, so following our reconstitution and administration, so for IV continuous, we're going to be adding 100 units using a 3 ml syringe to drop 1 ml of 100 units per ml insulin, then be injecting that 1 ml into a 100 ml normal saline mini bag. We're going to be following a colleague pump setting. So again, here our recipe: 100 units is 1 ml, 100 units, 1 ml of 100 units per ml, further diluting it in normal saline, 100 ml, final volume 101 ml, final concentration 0.99 units per ml. And for our compatibility, so it is compatible with normal saline, which is good because I know the patient has normal saline running TKO in their room right now. And we'll be mixing it up with normal saline. Some potential hazards are hypoglycemia, so blurred vision, sweating, tremor, which we'll be letting the patient know about. And then just additional notes of exactly how to draw it up. So we have a 3 ml syringe. We'll be drawing up 1 ml and injecting that into a 100 ml normal saline mini bag. Okay, so now that I've gone over the PDM, I'm going to do a first check with the MAR, the PDM, and the medication vial. So we know it's for Scotland and Finn 1, 2, 3, 4, 5, 6, 7, 8, 9. We have an order for insulin Humulin R. We went over the PDM for insulin Humulin R, and we have insulin Humulin R. Our dose, so following our recipe here, our dose will be 100 units that we'll be injecting in a bag. So we'll have 100 units in a bag. Our final concentration will be 0.99 units per ml, and then we'll be running that at 2 units per hour. And yeah, so we'll be drawing up our 100 units from here. So we have that 100 units per ml. It has been ordered as an IV continuous med. We've gone over the PDM for IV continuous, and we will be drawing up an IV med. It's been ordered for today and now, and we'll be drawing it up today and now. Okay, so now I can start drawing out my medication. So I'm going to do hand hygiene. So I have my medication. I have the 3 ml syringe that we'll be drawing up 1 ml out of. So I'm going to clean the top of the vial for 30 seconds, letting it dry for 15. Okay, so spraying sterile, I'm going to draw back 1 ml of air, and I'll be injecting that into the vial. Okay, and I'll draw back 1 ml. Okay, so we have that 1 ml. I'll be recapping carefully to remain sterile. Make sure we have no bubbles. exactly 1 ml. So right away, I'm going to be labeling that with that it's insulin-humulin R, 100 units, which is 1 ml, which we have in here. So I'm going to label that right away. Okay. And I'm going to be injecting it into a mini bag of 100 ml normal saline. So I'm making up the tag for this. So we have Scotland Bryson, insulin-humulin R. Our dose is 100 units in this bag that we'll be injecting out of this syringe. Our volume of our dose is 1 ml in the syringe that will be further diluting in 100 ml normal saline. We'll have a final volume of 101 ml. And a final concentration of 0.99 units per ml in this bag. It's been ordered for today and now, and it has a signature, and we'll be getting another signature, and then also our infusion, insulin infusion running at 2 units per hour. That's our ordered rate. So now I'm going to do a check with my medication, with the MAR, the PDM, the medication, our medication bag, and our medication that we've drawn up in the syringe. So we have Scotland Bryson. We've gone over the pen. We're drawing it up for Scotland Bryson. Our drug is insulin-humulin R. We have insulin-humulin R. We've gone over the PDM for insulin-humulin R. We have insulin-humulin R. And we have drawn up insulin-humulin R. Our dose, so following our PDM, we needed to draw up 100 units of 1 ml. 1 ml of 100 units per ml. We know that we drew up 100 units per ml, which was 1 ml that we drew up in here. And then we injected that one, or we will be injecting that 1 ml, 100 units into this mini bag. We'll have a final concentration of 0.99 units per ml, and infusing it at 2 units per hour, 2 units per hour. It's been ordered as an IV continuous med. We've gone over the PDM for IV continuous. And we've drawn up out of an IV med into the syringe. IV, we'll be injecting it into this bag to hang it as an IV med. It's been ordered for today and now. And we've just drawn it up for today and now. So now, before I inject the medication into the bag, I'm going to get a second nurse to come in and do an independent check. Okay, so they have come in. They've checked it all over, and they're saying, yeah, it matches up. So, I would be using a new alcohol swab to swab this port for 30 seconds, letting it dry for 15. So new alcohol swab.
And I can go ahead and
okay, so I can inject that medication there.
Pull up my medication.
And give it a little rotate. And make sure our label is fastened on well with that second signature.
Now here I would swab and craft.
Okay, so
the morphine napules.
just keep it away. Our nurse is checked, so we can prepare to go to the patient's room. So going to the patient's room, I have the MAR, our medication, our portless tubing, and I'm going to just label this tubing. So we have portless tubing, making sure it's all clamped, and I'm going to be labeling it with the infusion, and so that it's insulin, and it's been ordered for today and now. So I'm just going to label that. And then I also just have a flush to flush the port. Okay, so I'm walking into the patient's room.
Then I can go ahead and label my scans right away.
I'm walking in, I'm doing a little safety check. And I'll do my hand hygiene. So hi, my name is Paige. I am a student. I'm a student nurse, and I have for you your insulin. The reason we're giving you insulin is to help manage your blood glucose, to get you out of to get you to 6 to 10 blood glucose level that the doctor has ordered. So I'll be frequently monitoring your sugar levels. Some side effects you might experience of low blood sugar is dizziness, sweating, palpitations. So if you notice anything out of the ordinary, be sure to let me know. And I'm going to be frequently monitoring that and your vital signs to make sure we're getting in that goal blood glucose range. So I am just going to do a third check here, and I'm just noticing also that the patient has a normal saline bag running TKO.
And then they're all 1 ml afterwards, so.
I've washed my hands, done my hand hygiene, so I'm just going, so it's running well, the IV site looks good. I'm just going to do a check here. So we have Scotland, Bryson. We have Finn, 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. And could you just state your first and last name? Okay, perfect. That matches up. I'm going to do another third check here quickly. So we've done our name and Finn. We have insulin humulin R. Our dose is 100 units total in this bag, which we drew up from 1 ml and injected it into this 100 ml normal saline mini bag. We have a final volume of 101 ml, final concentration of 0.99 units per ml, and we'll be running that at 2 units per hour. It's been ordered as an IV continuous med. We've drawn up an IV continuous med. That's how we'll be giving it. It's been ordered for today and now, and it has been signed. So now that I've done my check and I know our TKO is running well, I can prime my bag now.
And I'm going to label my bag right away.
So making sure
Once my bag's labeled,
everything is clamped,
and my bedside is my monitor. So upon entering the
and I've done my hand hygiene, I can now spike my bag.
hygiene, do my entrance safety check. Bed would be lowered, but I've raised it in this demo already.
And everything is clamped, so I can hang this up.
Lower the bed, so I'm doing my entrance safety check, and then I'm going
And now, just over the garbage, I'm going to prime the line to make sure there's no air or anything.
So I'm going to check my identifier for the bed. So I'm going to see
Okay, so I'm looking.
So I see that all matches. I see
It has all come down now. We have no air bubbles left. So I can go ahead and clamp that. And now I can enter my tubing into the pump. So we're clamped, we're capped, everything's sterile. So I hit primary, and I can load
then we have our PC dose 1 mg. So using your state,
my tubing.
we need a dose of 15 mg and a volume of 5 ml. With the dilution of 45 ml, so a total of 50 ml.
And for this infusion, we need to be running it under a colleague guardian setting. So I'm going to hit colleague guardian. I'm going to go down to insulin. Okay, insulin, select. And now I'm going to be comparing this settings with my MAR and my label here. So we know we have insulin. Our drug amount is 100 units. We have 100 units total in this bag. For final, we have our diluent volume is 101 ml. We have 101 ml in here because we have the 100 ml normal saline, and we added that 1 ml. So we have a final concentration of 0.99 units per ml. We have 0.99 units per ml, and we will be running that at 2 units per hour. 2 units per hour. So I can enter in 2 units. That will automatically put in our rate. And then our volume we know is 101 ml. We have 101 ml in here because of the 100 ml normal saline that we added the 1 ml in. So we know that matches up, but I'm going to get a secondary nurse to come in and do his own independent check. So everything's labeled. So they are saying that everything looks good. So I can hit confirm.
Then I'm going to.
And I have hand hygiene.
So I'm going to go new.
And I know this, they have their TKO running. It's all unclamped. It's running well. It's hooked up. The IV site looks good. Okay, so
program. Yes, for the field one. So we're gonna have units, yes, concentration. We have 1 mg per ml. So we administer to IV, yes, IV. We don't have a load in there.
really stuck.
And then limits are off there. And then next page.
It's
So
stuck.
that volume is 150
So we're just getting our flush.
Yes, basal rate.
Thank you.
Patient bolus is going to be
Okay, our flush is open, and I'm just making sure there's no air bubbles.
so 5 minutes. Yes. And then our bolus is per hour.
I can
The bolus is
alcohol swab for 30 seconds, let dry for 15.
yes.
I'll flush
Done. So now before I'm starting, I'm going to get a second.
just for patency, so everything looks good.
it all. So once they
And now it's safe to attach my line to the patient because